Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, the impact of healthcare on climate and what can be done about it. Shanda Demorest is a nurse and associate director of climate engagement and education at Healthcare Without Harm. She takes Dr. Josh Sharfstein on an imaginary tour of a hospital, identifying places and ways to reduce the emissions of greenhouse gases. Let's listen.
Shanda Demorest, thank you so much for joining me in Public Health on Call. You are with an organization called Healthcare Without Harm. Could you tell me a little bit about what that organization does?
Absolutely. And thank you so much for having me. So the legacy of Healthcare Without Harm began about 25 years ago. And originally, the focus was mercury. Mercury in healthcare was primarily showing up in thermometers, blood pressure cuff devices, and the way that most hospitals were getting rid of that equipment after its use was to burn it, typically on site. And so burning mercury leads to poisoning of air, poisoning of water. Patients in the same communities where these hospitals were sited were suffering from mercury poisoning. And over the years, Healthcare Without Harm has expanded from that original focus on mercury to other chemicals of concern. And now our primary goal is protecting public health from climate change.
Climate change and healthcare, not necessarily an obvious connection. Just at a high level, what are the contributions of healthcare to climate change?
Well, at a high level, estimates show that about 8.5% of U.S. greenhouse gas emissions come from healthcare. So the daily operations of taking care of patients contributes to 8.5% of our entire nation's emissions. Climate change impacts human health, which really is at the core of what we're talking about here. So whether it's extreme heat, air pollution, vector-borne disease, asthma, allergies, you name it, climate impacts patients. And if the sector's contributing to climate change, we're not making good on our mission to do no harm.
I wonder if it's possible to tell me another industry that contributes about 8.5%, or just by way of reference.
Sure. Yeah. Great question. Off the top of my head, I don't have a specific, but what I can say is that the two sort of leading industries that volley back and forth for emissions in the country are the electricity industry and the agricultural industry. And both of those are around 25 to 30%.
So this is a fair amount of emissions and potentially modifiable.
Absolutely modifiable. I mean, we have some of the innovations and solutions in our hands today to increase our energy efficiency, to decrease the emissions that we're releasing as part of the hospital's operability. And there are a lot of practices that individual practitioners can take just to reduce the emissions that are part of healthcare.
Okay, so let's you and I go on a virtual tour of a hospital, and let's just look around, and maybe you could tell me what you're worried about and what could be done in each area. So stop one, we walk into the hospital and you look around. What are you thinking?
Look at the built environment. What materials make up the walls? Where did that come from? Was it shipped from another nation? Was it purchased locally? Are there materials that were used that are low carbon and contribute to fewer emissions? Another classic thing would be heating, ventilation, air conditioning. Are those items optimized so that we're not using extra energy to circulate air or change temperatures in a way that's not necessary? Maybe in the same way that you'd focus on that in your own home.
For big buildings, this might get into some of the certification standards.
Yeah, LEED, L-E-E-D from the U.S. Green Building Council is a great resource there.
Okay, so now we maybe go into the administrative area and you see all these machines. What are you thinking?
Do the machines need to be there in the first place? Does every workstation need a computer? Could there be planned downtimes, maybe during low census days or even during night shifts, for example? I'm a night shift nurse by background.
And then what about the patient care areas? You've got a lot of high-tech machines. Are there better or worse ways to use them for energy?
That's an excellent question. You mentioned some of the high-tech and also very energy-intensive machines like X-ray scanners, MRIs, CTs. The radiology department is a hotbed for energy efficiency opportunities. So I mentioned downtimes for computers or other electronic equipment. Same intervention can be applied to those high-energy scanners, for example.
And I've heard you talking about the supply chain as well, meaning even your basic medical equipment like IVs, it could be high energy or low energy. Could you explain more what you mean?
Yeah, I'm glad you asked about this too, because when we think about basically the parts of healthcare that contribute to greenhouse gas emissions, there are estimates in a report put out called the Healthcare Climate Footprint that states that the supply chain in healthcare comprises about 70% of greenhouse gas emissions. So you mentioned IVs, but think about every single item that comes into the door that practitioners are using to take care of patients. And that includes things like food. That includes things like even the ambulances that are bringing patients to the emergency department. So, when we consider the opportunities for decreasing emissions in the supply chain, not only are we thinking about increasing reusability, decreasing things like single-use devices, or even increasing purchasing related to reusable linens, or increasing local purchases so that different companies that are closer to the facility are providing those materials and they're not having to be produced, shipped, transported, distributed from other parts of the country or other parts of the planet.
Well, this is some tour. Do you mind if we stop for a second and have a snack somewhere?
Yeah. A locally produced and sustainable snack. Yeah, absolutely.
Because food, I imagine, is also a contributor.
It absolutely is. And that's a very enticing sort of starting place for a lot of health systems to improve their sustainability and reduce emissions, because food hits home. Everybody eats. That's what makes us human. And so decreasing even things like animal products. There are some really fascinating co-health benefits for increasing plant-forward foods that show up in the health systems. And are there opportunities to buy materials from just down the street? That increases economic benefits for local and sustainable companies that are within the same communities that these health systems are located in as well.
I don't know how we got here, but as we're leaving our tour, we wound up in the parking garage.
Yeah. That has a very nice connection too with how staff, patients, even family members are getting to the hospital in the first place. Are there ways to increase carpooling, decrease single occupancy vehicle travel, even electric vehicles? Well, there are some really compelling examples of health systems that are transitioning to electric fleets, maybe for couriers or even ambulances.
So let's talk about what hospitals are doing to make you smile more on this tour rather than furrow your brow. Are there voluntary standards in these different areas at least? Let's start there before I start to ask you about what requirements might be in place now or in the future. Are there voluntary standards that hospitals are pursuing?
Yeah, great question. So right now, the preeminent organization that puts out those voluntary standards is called Practice Green Health. There are about 1,500 hospitals in the nation that are participating basically in Practice Green Health to increase their environmental sustainability. So it's broader than climate. We are talking about water efficiency, chemicals of concern, broad sustainability work that might even be as core as developing an environmental commitment statement or a mission for environmental sustainability. Another voluntary commitment right now that's really important to recognize actually is put forward by the Human Health and Services Department. The Office of Climate Change and Equity was just established a couple years ago through HHS, and they released something called the Health Sector Climate Pledge on Earth Day in 2022, which invites hospitals, and now there are over 800 that have signed up for this. These hospitals are pledging to reduce their scope 1 and 2 emissions, so those operational emissions, 50% by 2030 and 100% by 2050. So that pledge has garnered a lot of attention.
I can imagine. Now, are there requirements kicking in on any healthcare facilities in different parts of the country?
Yeah, that's a fuzzy question, an important question. Not at this time. And honestly, that's what we need is our regulatory bodies to establish standards that hospitals need to meet in order to decrease their harm on the environment. There was a call out from the Joint Commission just a little bit ago in 2023 that was soliciting commentary on a few proposed standards around emissions reduction and sustainability structure. And honestly, the pushback that the Joint Commission received to establish mandatory requirements pertaining to environmental sustainability was such that they wheeled back those recommendations and currently are not planning to put those into place within the next couple of years.
The Joint Commission being one of the creditors for hospitals.
Right.
So where does that leave us if somebody's listening to this podcast and wants to check if their hospital is doing what it should or aware of this issue even? What would you recommend someone to do?
Well, I'd like to start with number one, protecting patients. Like that's probably what brings folks to your podcast. They're taking care of people who need it the most. And so if there are ways to help folks be more aware of some climate vulnerabilities, whether that's heat, air pollution, or even extreme weather like flooding and drought, how can those patients be better prepared? There's some excellent resources on Healthcare Without Harm or the Global Consortium on Climate and Health Education. But if you want to up the ante, I think the most powerful role that health professionals can have is to use their voice and putting pressure on leadership and health systems to really step up and make these, which are voluntary commitments at this time, but to reduce emissions and basically to help move the sector forward. So ask around. I promise there are folks within your health institution that are starting to think about this, starting to talk about it, and are probably in desperate desire of health professionals that can add that human health care voice and add that power to the movement overall.
And what about patients? We have a lot of listeners who may not be health professionals, but are wondering what they can do.
Yeah. Start by asking your health professional, hey, how can I protect myself? How can I be more climate resilient? Write a letter to the editor. Get that topic out into public consumption. Write about your own experience, which is, the richest platform you can ever speak from. And certainly there's a legislative and policy component to this. And so, I shared that the Joint Commission, that regulatory body, they are not at a place today where they are willing to require health systems to do this work. But we're seeing pockets of interest and pockets of deep movement show up in local, state, and some regional regulations as well. So using your voice as a patient and elevating to the folks that are in elected office that this is a priority and that healthcare needs to step up and recognize the damage it's doing and to mitigate future damage. Something we can all do, patients or otherwise.
Well, Shanda Demorest, thank you so much for coming on the podcast, going on this tour with me, telling me about what is happening, but perhaps what can happen better in the future. Thank you so much.
It was my pleasure. Thank you for giving a platform for this content. It's so important.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.